Thank you everyone for your attendance today. My name is Ameri Arias. I am an admissions officer here with the online programs of applied learning at Johns Hopkins University Bloomberg School of Public Health. Today we'll be discussing our Global Health Graduate Program. Joining us today will be Dr. Bill Brieger, Director of the Global Health Graduate Programs, and myself. My name is Ameri Arias. I am an admissions officer for the online programs of applied learning. I work with our team here to assist students as they are exploring their options for continuing education. I'm excited to be presenting with you. Dr. Brieger, could you please introduce yourself?
Hi, I'm Bill Brieger, and I'm directing actually it's 3 programs, 2 masters and a certificate, and look forward to answering your questions and maybe even seeing you next fall. Okay. So what we are trying to stress in our department, which is called the Department of International Health, is that it's a false distinction between what is international health, what is global health. Basically, all of either term deals with health systems, health programs, health interventions in a global, worldwide context. So we're looking at equity, we're looking at involving multiple disciplines, whether it's epidemiology or social sciences. And basically, we're trying to address health concerns from both the local and national level. We do get into the international arena with major organizations and the role they play in promoting programs such as the World Health Organization or UNICEF. Our courses will be examining things, like I said, from the community level and how local beliefs and practices influence health. We'll look at systems level, where we can find out how health systems are organized to provide access to people, the challenges in terms of funding, financing, organization of these services. So basically, throughout the world, we do comparative work of looking at health on a global level across different countries and region. Also, the Alma Ata Declaration, which was a result of a conference held on primary health care in 1978, UNICEF and WHO organized it, and out of that, the concept of health for all arose. And so again, this approach, which is now again called or focusing on universal healthcare, universal coverage, tries to see how in each different community, each different culture, healthcare can appropriately be designed and reach the needs of the people. And we've designed our OPAL programs recognizing that 1, we need to look at the community level through primary health care, and 2, we need to look at the organizations who deliver the services through our planning and management. Okay. So, as we said, our department is sponsoring the programs through the OPAL program. We were the first department that looked at international or global health, founded in 1961. The department is seeking to understand health problems and develop affordable means of disease reduction, health protection, affordable interventions that are appropriate for underserved populations throughout the world. And so we, obviously, a lot of my work that I worked for 26 years in Nigeria, and so a lot of my lectures and talks focus on Africa, but we have other people in the department who have worked with Native American populations, and so that is an underserved group that we are addressing. We have people who have worked in Latin America, people who have worked in Asia. So we try to have a perspective of how the needs of people throughout the world can be addressed in an affordable way. And so as a department, of course, we conduct research, we do a lot of education, and we're looking for new ways of reaching people with our education, which is the whole motivation for us to get involved in the OPAL program, to reach people we haven't reached before, reach people who cannot easily come and sit in Baltimore for a year or two. And so again, training more of the people throughout the world, we can improve the capacity of organizations to achieve health for all. Okay. So we have two main audiences in mind when we designed our OPAL programs. We recognize from our experience visiting many countries that there are people working in ministries of health, in non-governmental organizations, in international organizations who are mid or early career people looking for a way to advance themselves professionally, recognizing that if they got an advanced certificate or an advanced master's degree, this would improve their prospects on the job, but also, more importantly, strengthen their skills to deliver better health services in their countries and communities. And so we also, of course, have people who are already working in the field, but they don't necessarily have the global health qualification after their name. And so this, our courses can offer this to people who are already doing the work, but want to have that kind of certification. Okay, thank you. So our graduate programs, and we have quite a number of different kinds of programs to reach different audiences, but what they have in common is that we prepare students to manage health initiatives in a wide range of organizations around the world. And this may include development agencies such as the United States Agency for International Development, the British Department for International Development, other national programs, bilateral programs, also people who can work in or with low and middle income country governments, such as ministries of health, health facilities, primary and secondary programs, health programs, and of course global agencies such as the Global Fund, the UNICEF, WHO, quite a number of NGOs that we've worked with, that people can work with, everything ranging from World Relief, International Rescue, JPIGO, which is a Johns Hopkins affiliate. There are a number of NGOs who are actively involved. So we hope to attract people from all of these organizations and help them work better in that context. Next. Just a brief look at some of the work that goes on in our department. Our department is divided in 4 different divisions or sections. We have human nutrition, health systems, social and behavioral interventions, and global disease epidemiology. But in addition to those academic and research divisions, we have what we call centers. And here is how we focus on a wider variety of health issues around the world. As we said, we have a major center for American Indian health that works throughout the US and Canada. We have centers focusing on nutrition, humanitarian health, immunization, M-health, which is an up-and-coming field. So we're concerned about maternal and newborn health, vaccine access and safety, so international injury research. So we have quite a number of programs specializing in different aspects of global health, and faculty from these different centers will be teaching the courses you take. And just quickly, a look around the world at the many different countries where we work. And as I said, not to be surprised that we are working in the US because we do have key underserved populations here, whether it's in rural Appalachia, inner city populations, or Native American populations. But we're basically having research on every continent except Australia and Antarctica. Okay. So our programs are skill-based. Remember, the The master's part is called applied science, and so we want to ensure that people have skills to develop sustainable solutions for health problems, not just in individual countries, but across borders, within regions. One of the things I work on a lot is malaria, and we know that neither the mosquitoes nor the human beings that are infected stay easily within one location. They go across borders, and so we need collaborative efforts to address these kinds of problems to advance our health initiatives. We have the basic first year, and I'm using the word year loosely, but the first set of courses are comprised of 25 term credits, and this comprises our graduate certificate in global health practice. This serves as the foundation for our master's degrees. People can apply for the certificate. We've had people with advanced degrees that are not looking for another postgraduate degree like a master's, but want a certificate so that they can gain the knowledge and skills specifically focused on global health. Whereas others, want the advanced master's degree, and along the way, if they complete the first step, which is the certificate year, then they will get the certificate in addition to the master's when they finish that. So we do have two masters branching off after the certificate program. One is in community-based primary health care, and this has altogether, counting the first 2 years, 50 term credits, and then we have our Master of Applied Science in Global Health Planning and Management. So again, we have a number of important general courses that are offered by the school, such as for professional development, and at the end of the series of courses, and again, you may take this in 2 years by taking 2 courses per term. You may spread it over 3 or 4 years. But at the end, in your last term, you will have an integrative activity, which will help you hold together what you've learned over the 50 or so term credits into a practical application, looking at a real life situation where you're working or want to work, and develop a program using the skills that you've gained. So again, we're looking at skill based orientation. We're looking at working professionals. The key issue is that it's part-time. We recognize that people are not always able to take off a year of their life and do a master's program in a particular location because of the expense, because of work and family and other commitments. And in order to do that, of course, it's 100% online. So we try to be contemporary with group learning, peer assessment, various kinds of interactive assignments. We do have recorded lectures. We have weekly live talks where people can attend and ask questions directly to the faculty and to each other. So we want to have a hands-on experience where you develop and you respond to assignments that are asking you about real situations in your work and life environment. Okay. So again, the first step, we call it year one, but some people you can take 2 to 3 years to finish these courses. This year one is also equivalent to the certificate. There are some things that one needs to complete before September of the year we start, before term one. And this is something that we really try to stress, because especially if you don't take, it's not listed here, but the Introduction to Online Learning, if you don't take that prior to starting the first class, you won't have access to our web-based courses. So this Introduction to Online Learning is offered many times a year. In fact, people who are intending to apply to Hopkins but aren't yet accepted can still take the Introduction to Online Learning by going to the school's website, looking up Introduction to Online Learning and signing in. But definitely no later than completing by the end of August, it's important to complete that course. Also, there are academic ethics course. These are 0 credits, but again, all students coming into Hopkins have to take this. The first year we have, we basically have 2 courses available per term, so that if people want to finish more quickly, they can take a maximum of 6 credits, in some cases 7, but 2 courses to meet that requirement. If you are getting financial aid, which we'll talk about a little bit more later, the 6 credit minimum per term is required. So the opportunity is there if you want to do that. Otherwise, you can spread it out. But we have seminars in public health that draws on all the faculty in the school. We have a introductory course to global health called Fundamentals. We have our own specific ethics in global health in the second term, and program design in primary health care, also second term. Then we get into 2 epidemiology courses, one that's general and the other that's specifically applied to global health in the third term. And we wrap up the fourth term of the certificate program with a basic statistical course, and also looking at the social, cultural, and behavioral aspects of community and primary healthcare programs. So this first year should give you an overall an overview of global health, from the epidemiological, the social, the behavioral, the ethical, the demographic points of view. Okay. Then, after you've completed the certificate courses, you can branch off into either the community-based primary health care or the global health planning and management. So again, in the first term, we have actually 3 courses available. We have an important 1 credit course on getting prepared to do a global health assignment. Some of you have done these assignments before. Some of you, you hope to do so after you've gotten your certificate or your master's. But this is an important step-by-step look at how to get prepared. We have a course that looks at some of the basic components of primary healthcare, and particularly essential medicines, and how these are managed at the community level. Again, the community-based primary healthcare program focuses on work with communities, community involvement, community participation in organizing and delivering primary healthcare services. So the courses try to emphasize, working with communities, and in this case for essential medicines. And the third course for the term 1 in year 2 is looking at evaluation. This is an important skill. How do we know our primary healthcare programs have reached people, have made an impact on them? In the second term, in the year of the PHC program, primary healthcare program, we look at primary healthcare in urban context because countries are urbanizing quite quickly. We also look more at some of the evaluation tools covered in term 1 when we look at survey methods for community-based primary health care. One of the general OPAL courses to help you prepare for your integrative activity is professional development and writing skills in the third term. Also in the third term, we have a course on organizing training programs for community health workers. Finally, we have an overview, an up-to-date look at how do you build the capacities of communities to set up and run their primary healthcare programs. And the key activity for the final effort is your integrative activity, where you will step-by-step draw on all the courses you've taken, plus looking at experiences in a community where you work or where you want to work or where you have worked, and applying those, developing a case study for either strengthening those interventions or developing new ones. So that's the curriculum for the primary healthcare master's degree. Then in the next slide, we look at the global health planning and management. Okay, again, this is for working in NGOs, in ministries, in actually the overall management of programs at a state or regional level, even a national level. Both programs will look at this health and safety preparation. One of the key courses in the term one is, we've talked about essential medicines for the village level, community level. Now we're talking about for the planning and management group, the organizational group of policies and management of essential medicines, in the organization as a whole. And then we'll also look at a health systems framework course in terms of, how can we ensure we have strong health systems in global health and low and middle income countries. We have another systems course. Again, this is because the global health planning and management people are focusing at the level of systems, the organizational structure change management. So we have that. We also have quality management issues in another course. This is particularly concerning because it's one of the things that recently have learned through research is that poor quality care can be more detrimental to people than lack of access to any care. So we really want to focus on looking at how to improve quality. The third term, the professional development and writing session, is available also for this group, because again, both groups will be doing their own integrative activity. Health information systems are extremely important for understanding how organizations function, how services are delivered. So we'll have a course on that in the third term. And then in the fourth term, in addition to doing the integrative activity that's geared toward improving program management in low and middle income countries, we'll have a course specifically on working with non-governmental organizations, because they play such a major role in global health in low and middle income countries. Okay. So this is just a quick overview of the department. Not everybody is there because they wouldn't fit if they had been. This was during a recent event at the school, recognizing the anniversary. I think it was the 50th anniversary. But right now there are 194 full-time faculty and various types of faculty, whether they're professors, scientists, or research associates. In addition to that, almost 200 people, not all of them will be teaching you courses, but we draw from that group. We have associates, both adjunct, joint faculty, visiting faculty, over 300 of those who help, and they may be giving guest lectures in some of our courses, for example, during live talk. We try to have a diversity of staff because we are global and trying to reach a variety of people. And of all the people, we also have important people who make sure that things run well, that students get the programs they need, that they're kept up to date, that the department functions well. So we have 200 full-time staff and 51 part-time staff. So all of this was put together, was put to bear in developing the curriculum and setting up these three global health programs. Here are some of the people that you'll be listening to when you if you sign up for the courses. Mariah Merritt is handling our global health ethics. Ligia is concerned with the systems approach. Henry Perry with primary health care, as is Anna Kovarczyk. Anna is working with the health and safety, and also with together with Alain Labrique in terms of the global epidemiology. We have a number of people such as Gil Burnham, and Ambrosy Edward, who are helping us look at organizing for primary health care programs. So we have quite a number of people. Rosemary Morgan is another health systems person, and Timothy Robertson will be doing the NGO course. I think I may have left off a couple people, but you can see that we're drawing on people from a number of programs and divisions and centers within the university, within our department in particular, to bring you a variety of experiences. So overall, Johns Hopkins University, but particularly the School of Public Health, has over 20 years of experience in online learning. I was in 1996 had come back to the U.S. My summer vacation away from the University of Ibadan, Nigeria, was spent teaching a course, that social and behavioral and cultural course, for MPH students in the summer. And while I was there, people in the program, MPH program, said, "Do you want to teach online?" And so I was one of the first handful of people in 1996 who recorded and actually started offering courses online. So we have a whole internet and online learning department called the Center for Teaching and Learning. And not only do they help us develop and produce all the courses, but they're the people that you can call on anytime when you're having technical difficulties with our websites. They ensure that we develop our courses with high production value, and we try to design it so that people are engaged throughout. So what's nice about the recorded lectures is that you can download them and take them with you. We have students who in the middle of the term may have to travel to another country for work, and so you can download the lectures and play them back on your iPhone or your pad or laptop or whatever. So we do have flexible learning this way. And as I mentioned before, the people in the Center for Teaching and Learning provide a 24/7 help desk for any technical problems. Okay. There are a variety of ways that different instructors use to assess performance. We do have competencies that we're required to address through the certification process and public health training that's national. And so there are a variety of quizzes. It's relatively simple to establish and actually take a quiz online. You get almost immediate feedback. We try to encourage the more interaction so that people learn from each other. We set up a discussion forum where people can post ideas and get feedback from classmates. Have a number of worksheets in courses, whether it's like in the urban health course where step by step you define and analyze and try to offer solutions for an urban health problem on a week by week basis. We talk about participation in our live talks. It depends on how each instructor wants to use it, but even if you're not in the right time zone to listen to a talk, you can, we put up a recorded version by the next day, and you can listen, and that is recorded. Some people use short essays, various problem-solving activities. So we do try to engage people in our social and behavioral and cultural course. We even have a course blog where we encourage people to, as an assignment, to actually write a blog posting and get critique and feedback from other people. Okay. All of our Master of Applied Science programs end with a integrative activity. Some people call it a capstone, but it's basically a project. This comes up in the final term. It's offered in the 4th term, so it comes up in the final term. It's worth 4 credits. And what we are doing, each program, each MAS program has a little bit different way of going about it, but what we are setting up is that class members on a step-by-step basis plan for strengthening an existing program, either in an organization or in the community, depending on which of the degrees they're in. They may also develop or proposal for a new program. So in the process of doing these step-by-step planning, you draw on your knowledge and skills, starting from everything you've learned about health, epidemiology and demography in year 1, training programs, social and behavioral analysis, surveys, health information. So all of the knowledge and skills will go into helping you undertake this integrative activity. We, as an OPAL program overall, do not organize internships. This is basically we call it an applied master's program. We don't have the capacity to do that, but we do provide information to people about activities that they may want to do. Some people do have free time. Majority of people are working full time, and the idea of doing an internship is difficult. But if people are interested, we can point them in the right direction, but we don't specifically require it or sponsor it. Okay. As we mentioned before, the different kinds of support available are the technical support from the Center for Teaching and Learning. We have academic support, so the faculty and teaching assistants in the individual courses you take can respond to any of your academic concerns during that course. Overall, we have student services on multiple fronts. So we have student services coordinator generally, and of course myself as the program director can respond to questions you have about your organization of your course, your registration, help with time management, address any technical or personal challenges that you might have in terms of completing things in time, your travel schedule, family needs that come up. And then the school overall, any student in the school is eligible to contact our mental and emotional health assistance programs who have confidential counselors who can work with people both in person and of course online. So there are a number of ways of getting through the 2 years.
Okay, thank you, Dr. Brieger, for all the insight into the 2 master's programs and our certificate program. I'm going to take some time to go over the admissions requirements. If you're interested in moving forward, it is important to know what you need to know about the admissions process. All our applications are processed online through SOFIS and SOFIX Express to streamline your application process. For our 2 master's programs, it is done through SOFIS. Our certificate program, your application is done through SOFIS Express. The requirement for the education is a minimum of a bachelor's degree from a regionally accredited college or university. The professional requirement, a minimum of 2 years of experience, specifically experience post-bachelor's degree, health-related, focusing primarily on health-related experience in low and middle income countries or underserved populations. Dr. Brieger gave some examples of that earlier in the presentation, talking about different backgrounds of students who can come and have come into this program previously. We do require a current resume or CV. to be uploaded into the online portal. The letters of recommendation requirements for the certificate portion is 1 letter of recommendation. For the master's application, you will need 3 letters of recommendation. The statement of purpose is a big part of the application process. This is where you'll be able to state why this program, how this program matches up to your career goals and your educational objectives, what you're trying to fulfill and what you're trying to gain out of the program, and how you hope to apply this to your career and future goals. For our international students, if English is not your first language, you may need an English proficiency exam. We accept either the TOEFL or the IELTS. For those who have obtained education outside of the U.S., for your academic records, it is a requirement that you undergo a course-by-course credential evaluation via the World Education Services. On this slide, you'll see that it's listed as WES, WES, which stands for World Education Services. I encourage you to review the WES requirements to see what what requirements are needed from your university and how your university should send those records to them directly. We work here at the Office of Admissions with students with this all the time. So if you have any questions, please feel free to reach out to us first so we can get you connected to the right resources, websites, and get you started on that process. Looking over the admissions information for our applications, we review on a rolling basis. So our application is currently open for the fall of 2020 start, which is August 31st. We review on an ongoing rolling basis, which means that you don't have to wait until the deadlines to receive an admissions decision from the committee. So we encourage students to apply early to receive your decision early. Applications are now open for our priority deadline for our master's program, which is April 15th, 2020. Our final deadline for the master's programs are June 1st, 2020. And our certificate final application deadline is July 1st, 2020.
Let me just jump in real quick and say that even if you are not certain about the master's, if you apply for the certificate and toward the end of the master's program decide you want to go on, you can separately apply through SOFAS to go on to the master's.
Correct. We are here to assist you through your application. So if you have questions or concerns on the application, you have a support system with us. We only enroll 1 time per year. So it's important that you know if you're excited about this program and want to start your application, they are now open until, the deadline. So you can start your application then. If you are interested in starting but don't want to commit to a full course load, you have the flexibility of starting 1 course at a time as well. To provide insight on the investment of school, right here is listed our financial information as well as some of the information about our financial aid office. For those who are eligible to utilize other financial resources such as FAFSA or private loan information, you can feel free to look at our website or email or call them. Their information is listed here. For the 2019-2020 school year, the tuition is $1,162 per credit. We do offer an OPAL scholarship, which is a partial OPAL scholarship that takes off $446 per credit, which leaves the student responsible for $716 per credit. The scholarship is specific funding for our OPAL programs, which is our online programs of applied learning. If you are admitted into the program, you are automatically awarded the OPAL scholarship. There's nothing additional that you need to do for that. If you are planning financially, we want you to plan for the $716 per credit at the current tuition rate. Of course, keeping in mind our tuition rate and scholarships are reassessed each spring. Any changes will be updated on our website in late spring. But just to go over the credits breakdown, our Master's of Applied Science, Global Health Planning Management is 51 credits. Our Community-Based Primary Healthcare Master's is 50 credits, and our certificate in Global Health Practice is 25 credits, each program at $716 per credit. Now we have some time for our Q&A session. We do have some questions already coming in. So one of the questions, I will direct this question to you. Dr. Brieger. So if someone does not have a previous academic background in public health, do they need to take any statistics classes or anything prior to be ready for the biostats or epidemiology?
I would say you might not. Hopefully these are at a relatively basic level. If you have done in your undergraduate any kind of mathematics courses, calculus, whatnot, that should help. If you've done any biology or other kinds of life sciences, that should help. I know some people have taken courses at a nearby college just to be sure, and you can certainly do that if you have the time and funds to do that. But at least the two introductory courses we offer should be okay if you've done math before, if you've done life sciences before.
Okay, our next question, if I'm interested in both master's programs, how should I decide which to pursue?
Oh, good. Well, I would say definitely don't flip a coin. Think about, where you're working now. Again, if you're working more with community groups, that would be the primary healthcare one. If you're more into the management level of organizations, including health ministries, I would apply for the planning and management one. Technically, at Hopkins, you can apply for a maximum of 3 different programs. And so if you can't decide, then you could leave it to us to decide when you tick off what you want to apply for in SOFUS. But it would be good to think about it and make your choice in advance. But of course, we can do that for you.
And just so you know, for folks that did sign in a little bit later, please submit your questions into the chat box that's available if you have any questions for us. I do have another question. Does an ECFMG certificate get someone exempted from the English proficiency testing? So I can answer this question. As far as the requirements go, we only do accept the TOEFL or the IELTS. Please feel free to reach out to us so we can get you connected to the right resources and links in order to do so. So as far as what we accept, those are the two tests that we take.
If the person has done any university level courses in the US or Britain, and those had to be instruction done in English, that might be another thing to consider. And depending on how long they've done that, we've had people who have come just for a couple-month internship, and that really doesn't always help. But the standard issues of having the IELTS and the TOEFL are preferable.
Perfect. Thank you, Dr. Brieger. Another question for us. I understand that it's about 18 to 20 hours a week for the 2 courses for the time commitment. Could you elaborate a little bit more about what that looks like?
Well, normally the rule of thumb for any university level classes is that for every hour in class, you would be expected to spend at least 2 or 3 hours in terms of readings, assignments, and that type of thing. So I think that definitely would apply in our case. There's certain times during the term when you might be busier than others, but I think that's where, so if you're taking 6 and 6 times 3 would be 18 or whatever, so that makes sense in terms of that general rule of thumb for time you take for any course in the university.
Perfect. Another question, can a veterinary student join the program?
Well, we definitely admit veterinary medicine graduates into the MPH program, and if it's a degree and definitely there is veterinary public health that many people have to take as part of their veterinary degree. You do have to take some of the other epidemiological courses, etc. So yes, that seems appropriate.
Thank you. If their ultimate goal is a PhD in global health or international health. Would this degree help them get to that end goal?
What we found with program, it depends on which university one goes to, because there are different kinds of requirements. I mean, in theory, a PhD or other degrees like that would require a master's degree. But then again, once you get into a particular university, you may be required to take courses that are unique to that university. So for example, at Hopkins, if somebody is admitted to our department for a PhD, if they went to another school, they may be required to take some of the basic courses that an MPH student would have taken to bring them up to snuff in terms of what Hopkins is dealing with. So that's the kind of thing. Yes, I think it would be acceptable, but it's up to each school what they expect you to do after you actually are admitted and on site.
Perfect. Thank you. What do you offer for alumni support? That is one of the questions that we got as far as alumni goes.
The school generally has an alumni association, and one can certainly join that. In terms of access to resources, I'm not terribly familiar. Fortunately or unfortunately, I think we've graduated just 4 or 5 people from the certificate program, so we're still relatively new at that. We have been talking generally across all the 6 masters and 4 certificate programs in OPAL about organizing something more specific for OPAL graduates. And so I would just say stay tuned, but you would certainly be eligible to join the Alumni Association and see what they have to offer.
Okay, perfect. And as far as how many students join the program each fall, do we have some insight on that?
I mean, since this would be our 3rd intake, the first year among the 3 programs, in global health we had 45. This year we had 66. So hopefully we will work toward increasing access to the course.
Well, thank you. This is a great question. How does these degrees differ from an MPH?
Technically, an MPH is called a professional degree. It has different requirements, in terms of the certification process for the program with the national accreditation bodies. And so it requires 80 contact hours, whereas you've seen in our slides, the MAS is around 50 credits. In terms of the academic workload, it's more equivalent to a Master of Science, Master of Arts. It's more specialized into a particular area. Some of the other ones you may have seen on the website, are like patient safety, which is a very specialized area. Community primary healthcare is a more specialized area than the MPH.
Perfect. Another question that we do have is, from my understanding, it differs by professor, but internet-based readings or purchasing of textbooks, will that be needed in order if I were to start the program?
Usually, if possible, I think most people we have an online library system for every course. And so what people do is try to make readings available, for download, those that we can, offer freely to people. And so I'm not sure what each and every person is doing in terms of textbooks. In my courses, I provide readings that people can download, refer people to organizations like the World Health Organization, UNICEF, that have detailed technical reports on various topics that we use. So hopefully there'll be less of that kind of expense.
Thank
But again,
you.
it depends on each professor.
Right. So as far as GMAT or GRE required for this program, I can answer this question. It's not required for the admissions process, but of course the admissions committee will look at every aspect of your file, including transcripts and what your grades were in each class. So you'll have that portion of the application to fill out as well with transcripts. So no GMAT or GRE. The structure of the 8-week term, can you kind of break that down for us a little bit, Dr. Brieger?
Well, first it goes very quickly. that's the important issue. So it's depending again on the professor. Usually, there are courses sort of divided into modules, and so a module with a specific content or topic area may be 1 or 2 weeks. So course may have 4 or 5 modules, may have 8 modules. So trying to deliver the content during that time, we try to spread out live talks so that if we have 4, maybe it's every 2 weeks, so we get together, then we try to spread out the assignments. Some people offer a midterm exam. Some people offer a final exam. Basically, in my courses, I try to have assignments that are due related to the modules and do on a more frequent basis and not save everything to the end. But again, it's up to the individual person. But the idea is that there is a course of study. Everything, fortunately, each course has its own web page, and you can see right from the beginning how things are lined up. Like I said, the lectures are usually spread evenly across the 8 weeks. Live talks are also spread. Assignments appear, in relation to the different modules and topics. So it is quite clear once you get online to see what each course is doing when you've registered for that course.
Perfect. One last question before we wrap up. We do have some questions that we weren't able to get to, but we are going to be contacting you through the admissions office to address those. Are there funding options besides the OPAL scholarships, like being a teaching assistant, Dr. Brieger?
We've been talking about this in the OPAL program directors meeting about teaching assistants. So far, we haven't agreed to do that, but because again there are requirements for the doctoral students that they have to be a teaching assistant for a certain number of courses, and so to meet their needs they help out with OPAL. But we do recognize that people are looking for opportunities. In general, there are no additional scholarships, but people certainly, like even with our MPH students, we may have 200 some MPH students, but the school only offers about 10 to 15 scholarships. But there are people that come with sponsorship from their employer, from NGOs that they may be affiliated with or hear about from various kinds of health-related companies. So if people are interested, I would encourage them to start looking at these opportunities. Ameri said that the school itself has already given a 1/3 off of the price of a credit as a scholarship specifically for OPAL students, but it certainly doesn't hurt to look for other opportunities.
Well, thank you. I thank you all for attending. If we didn't get to your questions, we'll be connecting with you offline. Our admissions team will contact you directly within the next few days and assist in answering your questions. If you want to connect with someone immediately, my contact information is on this slide, so feel free to reach out via email or directly call me. If you're excited about this program with the presentation and see this as part of your future, please feel free to use the scan code here to move forward with an application. And I hope you are ready to move forward and apply. We have a dedicated admissions team here who's looking forward to working with each and every one of you throughout the application process. Thank you, Dr. Brieger.
Yeah, thank you all for joining us.
All right, we hope you have a wonderful day, and we'll look forward to hearing from you soon. Thanks. Bye-bye.